Okay, we're doing a colonoscopy here. This is a colonoscope. You could see it's a long tube. It's about the width of my finger, but it's quite long, and this allows us to push it through the colon. We don't just shove it right through like that blindly. We actually guide it through with a camera that's at the tip, and we move this through the colon under direct vision. We have several buttons that allows us to flex the scope in various ways. So here we go. We're going in. This is the rectum, and you could see me slowly guiding the scope through. We are putting minimal air so that we don't cause discomfort and bloating for the patient. This patient is under propofol sedation with an anesthesiologist monitoring them. And you could see we're looking for the lumen. This is the opening, and this allows us to know that we can advance the scope. And here we are at the end. This is the cecum. This is the appendix opening. This is how we know we're completed the colonoscopy, and we're all the way at the very last portion of the colon. You could see the ileocecal valve is right here. This is the valve that leads into the last portion of the small intestine. For diagnostic procedures, we can go into that valve and evaluate the small intestine also. We're not going to do that here because this is just a screening colonoscopy for this patient for cancer surveillance. So as we pull back, we're going to carefully look for polyps. And if we find any, we'll stop and remove them. And here you'll see me retroflexing the scope. This is a turnaround we can do sometimes in the cecum to help us see around folds to make sure we're not missing anything behind a fold here. And as I pull back, we're going to keep looking for polyps. But sometimes we see other things. Like here, you'll see the patient has some diverticulosis. This is little weak pockets in the colon. For some patients, this can cause inflammation and pain. And we think this is related to the American diet, processed foods, over many, many years. A large majority of Americans end up with these by the time they're in their 60s and 70s. So we're done here. This patient did great with their colonoscopy. No polyps. They have, a clean bill of health now and can go home and have some breakfast.